privilege of introducing our chairperson, Dr. Medha Durandhar. Dr. Medha Durandhar, Head and Program Coordinator of Knowledge Discovery Analytics Group of Center for Development of Advanced Computing, Pune. After her PhD in mathematics, Dr. Medha worked on several research projects as postdoctoral fellow in UK. She has headed Ayurveda-based informatics solutions development. The R&D solutions of Ayurveda informatics were Ayusoft, a software for Ayurveda physicians and researchers; Cure at Home, a software for common man for primary health care; instrumentation-assisted pulse analysis; and mobile-based health technology solutions. She has published several research papers related to mathematical modeling and informatics for healthcare. She also has Indian and US patents to her credit. She is director of School of Advanced Computing, Mauritius. She was also invited by WHO on informatics solutions for healthcare.
I'll be talking about ICT for networking Ayurveda community. ICT stands for Information and Communications Technology. This is just an update for all of you. Information and Communications Technology is comprised of hardware, examples, PC, laptop, your mobile phones, printers; system software, which is the operating system. You have Windows or Linux or Unix on your PCs. That constitutes the system software. Then software utilities like PowerPoint, MS Office, spreadsheets, using which you do some kind of analysis, documentation, report generation, etc. And application software like hospital management systems, payroll systems, decision support systems like Ayusoft that you heard of just now. Communications technologies consist of networking, which could be a local area network for a particular building or an institute, or it could be a wide area network which networks people across different cities and centers. To look at the history of computers in medicine, way back in 1950, worldwide use of technology in medicine started. After that, Europe was the first one to adopt advanced technology for medical solutions. And in India, we started all this a few decades ago. But now everybody is striving towards developing solutions for bettering healthcare systems of the nations. Role of ICT in everyday life, you realize that with machine, best of man and machine can be sought, and we can better our productivity, we can save a lot of time and do more meaningful work. If you look at the various stakeholders who are affected by ICT or healthcare sector, right from households to students and researchers of academia to hospitals, practitioners, NGOs, insurance companies, to government, everybody today is a stakeholder in the healthcare sector, and each of these categories can benefit from use of ICT. These are the several end user categories. Individuals like practitioners, students, teachers, researchers, or even a common man is a potential user of ICT in healthcare. At institutional levels, hospitals, colleges, universities, research institutes, regulatory bodies, drug manufacturers, government and NGOs, they also are the stakeholders. And the various application areas in which these people can get benefit, draw benefit from ICT are clinical practice, academia, complex analysis with existing tools, policy planning, drug design and discovery, national healthcare and lifestyle and treatment advice. ICT is a powerful technique. Please remember, ICT is not there to substitute a human being, but it is there to assist you to come out with better solutions and deliver your productivity in a better way. So it's a powerful technique which is comprised of several media. There are static photos, there are multidimensional images, there is text, graphics, audio and video also involved in this. So this media could be very well effectively used and can be used for better delivery. We'll start from some examples in this area which can affect healthcare systems. You might have heard about distance education, teleeducation. Here the applications range from university education to public education on healthcare issues to real-time video broadcasting of an operation. This is happening in Japan and US, where they, through the real-time video clippings of the operations, they teach students how to carry out a certain activity. E-learning constitutes a virtual university. For this, you don't have to physically be together, but over internet or some network, teachers can deliver their talks, give courses to distantly located students. And the benefits of this is a student or a learner can decide on the time, location and pace at which the training is given. Today you know that a lot of constraints are there in providing good training, because even Ayurvedic domain is very vast. There are very few experts who are located at different places. Maybe they are very old, they cannot travel. Geographical boundaries also cause a lot of problems, but e-learning can solve many of these problems. Telemedicine, this is a virtual hospital. People living in rural areas or semi-urban areas many times have to travel a lot to come to a specialist, and it takes a lot of time as well as money for them to get the proper advice. But through telemedicine activities, a remotely placed patient also can benefit from consultancy of an expert located in some metro. Okay, the features are interactive communication. The communication is not one way. A doctor through telemedicine equipment can discuss questions with the patient. There could be electronic medical record generation and transmission. If that particular doctor feels that some expert advice is required from a specialist, he can pass on the data electronically to the specialist, who can offer his or her consultancy over the same network. So, scope of telemedicine is from a simple telephone call to as complex a solution as interactive robotic surgery, which, as I said earlier, is happening today in the Japan and US like countries. Information flow for telemedicine is, as I said, a patient is maybe approaching a remote facility of PHC or something, and through network the whole data is transferred to a hospital or an expert located at a long distance. Telemedicine again is a kind of a network which joins many stakeholders, right from medical service providers to universities, medical insurance providers, public institutes, etc. So you see, the strength of technology can bring people together, though physically may not be together, but it can, save a lot of money, energy and time for each one who is involved in this activity. With Ayurveda, we have a lot of knowledge, but there is a need to warehouse this knowledge, to bring it under one umbrella so that many people can benefit, many people can view the relevant portion of this knowledge base. You see that a diet and lifestyle database can talk to treatment and diagnostic database, and lot of these databases can be generated and connected together to deliver solutions. There are online analytical processing also. Once this knowledge warehouse is built, you can do a lot of analysis within no time. Decision makers normally require to do in-depth analysis of the data, but they have not much time to do this in-depth analysis. But today's tools and technologies make it possible for them to go through this process and come out with better policies and decisions. Today, computing power, you will see it is increasing, whereas the costs are decreasing. So at a much less cost, today you can do a lot more computing and do data mining to unearth some hidden patterns and form some predictive analysis and trend analysis based on huge data that is available to you. There are decision support systems for better decision making, which makes use of human knowledge and experience and computational capabilities of a machine. Even blogs and bulletins, today everybody is aware of these things. Even there is a community which talks about movies, movie stars, sports, politics, and there are blogs and close groups are created using this. So similar ideas can be usefully brought into practice even for sharing ideas and exchanging ideas. So again, the major stumbling block for using advanced technologies has been investment costs, which are quite prohibitive sometimes. But with today's paradigm shift, today cloud computing has come into existence. This is the latest technology that is talked about, using which you don't have to invest in hardware or even software. You can be part of the system and you can use somebody else's hardware, somebody else's software, because through the connectivity you can access these systems as if they are your own. So expanse of Ayurveda knowledge, as we know, there are thousands and thousands of books and manuscripts available. Lot many diseases have been studied since ancient times. There are more than 81,000 formulations available, so the knowledge base is vast. But we need to tap this knowledge base, construct it properly and use it effectively. And huge number of documents, references, experiential data, living tradition and knowledge in public domain is yet to be properly organized and structured, which can be useful for every one of us. Friends, don't feel that this talk is too technical or we have nothing to do with this. You can participate in this whole revolution as a user who can optimally use your own skills with the ICT. You can be a teacher, effectively imparting training, making use of multimedia techniques. You could be a student with huge amount of information available to you using these technologies. You could be a researcher who can exchange ideas, get into collaborative research with other people who are located in different countries maybe. You could be a practitioner who can benefit with updated information, drug discovery and design kind of activities. You could be a regulator who can monitor, screen, enforce quality control in the practice. You could be a policy planner who can base your policies on the effective use of data that is available, or you could be a solution provider. Definitely you can identify with one of these categories at least. So friend, the message is, let's make it happen. Don't be left behind in this revolution. You have to join this revolution, and it's nothing, no rocket science. Once you start working on it, it will be you will find it very useful, and you will actually get used to it so much that tomorrow, like mobile phones, when I feel very surprised when I see each and every person always talking on a mobile phone. I mean, I was wondering what we were doing when these mobile phones were not in existence. Nothing was happening or what. But everybody has got hooked onto this use of mobile technology, and you don't feel it's something alien, but it's part of you today. Similarly, ICT can be part of you tomorrow if you use it in a proper and effective way. Friends, we always invite people to come to us, share their ideas, get started on this, and together we can make many things happen, and global acceptance of Ayurveda can happen only with use of ICT, because then you can create evidence, you can show its effectiveness to people, and many things are there which are not there in modern medicine, which can be brought upon from Ayurveda-like systems. So my appeal to you is, please try to be part of this. don't put off using computers. It's no rocket science. Everybody can make use of it very effectively, and future solutions are going to come from you and not from me. Thank you so much.